Malignant brain tumors are cancerous growths within the brain that can be aggressive and life-threatening. They arise from abnormal cells that multiply uncontrollably and invade surrounding brain tissue. These tumors can affect brain function, depending on their location and size. Types of malignant brain tumors: gliomas, tumors that arise from glial cells supporting cells of the brain. Common types include glioblastoma multiforme (GBM), the most aggressive and common primary brain tumor in adults. Anaplastic astrocytoma, the malignant tumor of astrocytes, a type of glial cell. Oligodendroglioma, tumors originating from oligodendrocytes, which support nerve cells. Meningiomas, tumors that develop from the meninges, the protective membranes covering the brain and spinal cord. Though many are benign, some can be malignant. Medulloblastomas, common in children. These tumors arise from the cerebellum, which is responsible for balance and coordination. Ependymomas, tumors that originate from ependymal cells lining the ventricles of the brain and the spinal cord. Primary central nervous system (CNS) lymphomas, tumors that arise from lymphatic cells within the brain. Pituitary tumors, tumors of the pituitary gland, which can be benign or malignant. Symptoms vary depending on the tumor's location, size, and rate of growth, but common signs include headaches, often persistent, worsening over time, and sometimes severe. Seizures, new onset seizures or changes in seizure patterns. Cognitive or behavioral changes. Memory problems, confusion, or difficulty concentrating. Changes in personality or behavior. Neurological deficits. Weakness or numbness in one side of the body. Difficulty with balance or coordination. Vision or speech problems. Nausea and vomiting, often related to increased intracranial pressure. Difficulty with daily activities. Problems with tasks such as reading, writing, or recognizing familiar objects. Diagnosis: medical history and physical examination. Reviewing symptoms, medical history, and a thorough neurological examination. Imaging studies. Magnetic resonance imaging (MRI) provides detailed images of the brain and helps identify tumor location, size, and involvement with surrounding tissues. Computed tomography (CT scan), useful for detecting tumors and assessing their impact on the brain structure. Biopsy. Stereotactic biopsy, a procedure to remove a small sample of tumor tissue for microscopic examination. Open biopsy, performed during surgery to remove or sample the tumor. Molecular and genetic testing, to determine specific genetic mutations or markers that can guide treatment options. Treatment: surgery. Resection, removing as much of the tumor as possible, aiming to reduce symptoms and improve outcomes. Debulking, removing part of the tumor to reduce pressure and symptoms, particularly if complete removal is not possible. Radiation therapy. External beam radiation, targeted radiation to kill tumor cells and shrink the tumor. Stereotactic radiosurgery, a precise form of radiation therapy for localized tumors. Chemotherapy. Systemic chemotherapy, medications to kill cancer cells throughout the body, often used for tumors that cannot be fully removed by surgery or when there is a risk of recurrence. Targeted therapy. Drugs that specifically target genetic mutations or abnormalities within tumor cells. Immunotherapy. Uses the body's immune system to target and destroy cancer cells. Supportive care. Managing symptoms, such as pain, nausea, and neurological deficits, and providing rehabilitation to help with cognitive and physical function. Prognosis. The prognosis for malignant brain tumors depends on several factors, including type and grade of tumor. Higher grade tumors generally have a poorer prognosis. Location and size. Tumors in critical areas of the brain or those that are large may be more challenging to treat. Patient's age and overall health. Younger, healthier individuals may tolerate treatment better and have a better outlook. follow-up and monitoring. Ongoing follow-up is crucial to monitor for tumor recurrence and manage any long-term effects of treatment. This typically involves regular imaging studies, neurological assessments, and coordination with a multidisciplinary team of healthcare providers. When to seek medical help if you experience persistent or worsening headaches, seizures, or significant changes in cognitive or neurological function. For any symptoms suggestive of a brain tumor, particularly if they are new or unusual. Conclusion: malignant brain tumors are serious conditions that require a comprehensive and multidisciplinary approach to treatment. Early diagnosis and intervention are essential for improving outcomes and managing symptoms. If you suspect a brain tumor or experience relevant symptoms, seek medical advice promptly.